Hey everybody, welcome back to the channel. I'm Chad, aka Dr. Todd, with my wonderful wife Allycia. I made sure I got that out in the very beginning, since I have a bad habit of waiting until like 30 seconds into the intro to introduce us and the channel.
Sometimes a few minutes.
Well,
sometimes not at all.
We've made some changes around here. We're getting better at this, I hope. Again, thanks for coming back, checking this out again. If you're new here, thanks for being with us. We would really love it if you would consider giving us a subscribe, like, comment, all those things to help us grow this, because we've been having a lot of fun. We hope you guys have been having a lot of fun with us. But yeah, before, I guess, I don't know, not a whole lot to say. We're getting ready to get into episode 8 of the Pitt. I don't know, any comments before we get started?
Just that our 4-month hiatus.
Yeah, elephant in the room.
Yeah.
So this will kind of sound a little weird probably because we did record some episodes, but then took a long time to get them out.
Yeah, we recorded right before school let out.
Or I think it was right after school let out.
Was it?
Yeah, I think it was like in the week or two that school let out because we had gone on vacation, remember?
Oh, that's right.
Because we alluded to that, to going to Disney World. And then summer happened. She's heavily involved with our daughter's cheer organization, so she's coaching. We've just had
summer was just busy.
It's been in a really good way. Like, we spent time with the kids, we went swimming, we went on vacation, we did all the activities. Didn't get a chance to do a whole lot of this, but now that we're back in school, back in routine, we're gonna ramp this up because I'm excited to watch this as well as some other things, because I really want to get into House, maybe even Grey's Anatomy, maybe even some of the other medical shows, maybe even some non-medical shows.
Yeah.
So,
well, and one of the comments was that even though we were looking forward to episode 7, that they thought that Mel really shined in episode 8.
Yeah.
So, which is what we're getting ready to get into.
Yeah. Well, I think the backstory there is Mel is, I think, clearly our favorite. I think she's most people's favorite. I would imagine. I mean, she's a really, really easy character to like. She's smart. She's funny.
Even if she doesn't mean to be.
She's caring. She's a really good doctor. So, I mean, all the traits that you want. So, I guess without further ado, let's jump in.
All right.
The Pit. So imagine having that happen and then having to go back to work.
Yeah.
Having to go treat patients.
Is she about to go do an ultrasound too?
Looks like
of herself. Okay.
So at least she has the ability to do this.
Yeah.
Like the skill to be able to read it.
16 is open. How come nobody's been? My bad, it's taken.
Okay, now he's finding out.
Decent vitals, no head trauma.
Didn't we just discharge him a couple hours ago?
Stone cold sober at 7 a.m.
God, don't light any matches. How much did you have to drink, Louie?
Just a...
So like a half gallon?
Oh, hell no.
If you over-exaggerate your questions, you usually get a...
That's good advice.
Shouldn't we be concerned about an overdose?
Vodka is Louis' drug of choice.
True that.
Where'd the other 10 pills go?
Told him to buy the vodka.
What'd you do with the other pills, Louie?
Pocket, I didn't need them. Give it a rest.
Well, that was interesting.
Yeah, so she's highly suspicious.
Oh, because the pills are gone.
Yeah, the Ativan.
Dr. Rabinovich,
Yes, that is me.
here to see John and Lily Bradley.
Ah, yes. I will take you to the family room.
Dane, I need some help. Been trying to check the nursing notes on Louie from 7 a.m. Langdon ordered lorazepam, but I don't think it was given.
Turned unused to the PDS per Dr. Langdon as patients.
Is that unusual?
No, happens all the time.
Vial I couldn't open on our seizure patient.
Possibly.
Can we check the other vials in the PDS, make sure they're okay? I do.
All right, come on.
So she thinks that he is taking the medicine. I mean,
Yeah.
I think that was kind of what they were all hinting at all along, but it's becoming more clear now.
Calls from the hospital. My mom okay? Oh, yeah.
She's back.
I went to move my car.
She fell asleep, just like you said.
I dozed off.
I'm just really glad you're back. Oh, your mom is going to be so happy. She's waiting in the hall.
We knew she was coming back.
Did we?
I thought so. I thought she was coming back.
Take one out. And now we have 4 left. But if I click, turn one, unused, you put it back.
Oh, that's sophisticated. Is that how it was?
I never really used the Pyxis.
Oh.
Old man coming in with a heart rate of 30, pacemaker failure.
Could be a good case.
Putting an amputation in 15.
Ooh, that one sounds even better.
Yeah, sounds like fun.
How'd this happen?
I crushed under an air conditioning unit we were installing.
We'll numb up your finger.
Block 3 cc's of Marcaine.
P135 over 88 in triage.
2 grams of cefazolin.
Uh-huh.
Ugh.
Nice.
Go with the block.
You ready?
Pinprick and some burning.
The missing piece of skin.
It's,
Yeah, I was gonna say it's probably under the AC unit.
Close the wound. We're gonna trim down the bone. Surgery trick so the skin will cover everything. Your finger's gonna be a little shorter. No nail.
10% off manicures. Found you guys a new rig.
Nah, we Ubered.
Syncope from the Memory Day Center. They said he's more altered than usual.
30, BP's 80 over 40. He's got a pacer in his chest, but there's no cap.
Feeling, Mr. Alexander?
Call me Willie.
Fine.
Second MIG of atropine now. Push dose at 1 milligram portable chest.
It's not beta blockers, so junctional escape for them. Dead battery or lead failure.
Indeed. Good squeeze, even if it is slow.
Oh, dead battery on the pacemaker. Okay.
Yeah.
Let's start a drip, 2 mics per minute. Check the mental status.
Sir, do you know what year it is?
20-something.
Do you know where you are?
Like a hospital to me.
Pittsburgh Trauma Medical Center.
Yep, I know this place. It's Dr. Adamson's place. Where's he at? He working today?
You can't even talk about it.
I know.
Like this? Why?
They didn't have to show that.
Just so the sub-Q will cover. You need to take a few days off work, sir.
God, the sound.
Working the surgical borders. 2 incisions.
Advance the triangle to cover the tip.
Until the V becomes a Y. Exactly.
I guess you're the boss here?
Something like that.
Very good at teaching. You step back and with a few words, you impart wisdom.
Is that flirting? Yep.
Sleep. Yeah.
Blunt dissect to undermine the tissue.
What do you think, Dr. Devati?
Yeah, I think that's what the kids call Riz.
No relationship between the P waves and the QRS complexes.
Have a crushed finger and you're still still smooth.
Heart rate still in low 30s, no change with atropine.
We can try. Willie, Pacemaker isn't working.
You better fix it.
Pace your heart from the outside. You might feel it in your chest.
10 milliamps, rate of 60.
Pacer on.
We've done this before in the ICU.
Made the pacemaker.
Transvenous pacing, like if somebody had a heart block or something, or
Reset's on board. Flow to temporary pacemaker from your neck into your heart. Because your heart rate is only 30.
And hit me with,
You've already had 3.
Wait, are you a doctor?
Sleeping?
oh yes, I hope he's sleeping. Sounds like he's he knows what he's talking about.
Yeah.
Kiara told me about DHS Senior Phone Line, part of AAA, the Agency on Aging. They make referrals for in-home services.
Care will cover short-term home care, at least 10 hours a week.
It's a start.
Yeah.
Have you ever been to a senior center?
Nothing but old people.
Frida needs to be away at lunchtime. This program can deliver a meal.
Is everything all right? Yeah. Did I say something that upset you?
It's all good. This is way more than I expected.
I couldn't tell if she was happy or not.
You know, she was definitely happy. She's relieved.
Maybe she's just overwhelmed.
You doing okay under there, Willie?
I guess.
So this is just like a triple lumen?
Devin French introduced her to fit the pacing wire.
I could use some air.
That any better?
What y'all doing?
Did they just have it on his face?
Yeah, I mean, when you drape, I guess, yeah, when you drape the patient, it pretty much, you do usually have somebody try to kind of do this where they keep it off of them.
Mention of any medical career in his past records. Mild dementia.
Oh, you a doctor. That was a good one.
Did he say he was a good doctor?
I couldn't quite catch that.
Zero Foreman tube gauze. What's up, party people? VY flap. Can I borrow Dr. Santos?
As long as Dr. McKay can finish the dress.
Just no scalpels.
Yeah.
There's a high maintenance surgery clinic patient down here. Total pain in the ass. I could use your help distracting her. Every hero needs a sidekick. Find a tube gauze cage. I'll be right back.
You'll need to elevate biotics 3 times a day for a week.
Doesn't look like she's actually talking. It's like maybe the one flaw so far in the show.
It was just kind of obvious.
Sorry, I gotta go.
They say drowning victim.
We're looking for
An injury pattern.
Looking good. Check the pulse.
strong radio, really strong.
Feel like I just woke up.
Systolics up to 130. How do you feel?
Yeah, like $1 million. Widen QRS on the scope.
Do you have time to write the procedure note?
I'll be at Central if you need me.
Geez, I still need to tell Nandi about her mercury level.
See, doctor gets pulled from task A to task B every 3 to 5 minutes.
Again, why we picked this specialty?
We all have ADHD and anything.
That's pretty fair.
Do you think that we might be able
Drowning victim here. Not right now.
Amber Phillip.
Oh, God.
Faded with a cuff 4.5, 22 gauge left AC 3 minutes ago.
1, 2, 3.
I had to bring a kid.
Really cold.
Okay, you gotta get a cord tip. Should we use the Lucas?
No, she's way too small for that. Moderate hypothermia.
We need to get her up to 90 if we have any chance.
150 cc's heated saline.
So you can heat up the body through something intravenously?
They're going to use, she just call it the Arctic Sun. I think it's more thermal heat.
Oh, I just heard saline. That's why.
Oh, you can heat up saline. Yes, you can fuse warm
Right.
saline. I don't think I ever did or saw that, but we have used the Arctic Sun.
Did you read my chart? I'm allergic to morphine. Guts out.
That's a side effect, not an allergy.
Dilaudid.
I'll grab it from the PDS.
One is never enough. I need two.
Oh, wow.
Oh, wow.
Pertinent history, Javadi.
Have you had any fever or vomiting?
Oh, shut up.
Isn't that what was it called? Dilaudid? Is that what it's called?
Dilaudid.
Isn't that what people usually coming in on drugs ask for?
Yeah, it's a commonly
drug problem.
requested pain med.
That nothing else works for them.
Yeah. Well, and to be fair, like it is one of the most potent pain medications that you can get, and it does work. Like there is a need for it sometimes.
Yeah.
Dr. Robbie.
We're back.
My wife and I decided we're on board with organ donation.
That organ's going to go to that girl.
The church supports their decision.
He was sending an ambulance.
I guess there would be no reason for organ donation for a drowning.
Yeah.
Okay. All right.
For the little girl in Trauma 1, this is Grandmother Fran.
Hi, I'm Dr. Rabinovich.
How is she?
Bella, would you like to color? Maybe get us.
Honestly, her being cold is a good thing. Like it
Her body's going into a response.
it protects your organs.
Okay.
They are still doing CPR.
Can I please see her?
Oh, really? Well, I mean, I guess.
I guess I should rephrase that. Like it's not obviously
Yeah.
hypothermia is not a good thing, but it can be protective. And so heating her back up, you could argue that could have saved her life, that she was cold.
A medication that binds with the mercury and helps your body.
And then I'll be back to normal.
I don't know. Are any of us normal?
Where's my phone?
They locked it away with all your valuables. When you post, you have to tell everyone not to use the cream.
Can I borrow your phone? Just the camera. When I left my apartment, I had a wig when I came in, right?
Not when you came in.
Oh my god. I look like shit.
You are in ER.
Yeah. No, that's her whole bread and butter, right?
You know, yeah, it's her life.
This is Dr. Robin.
Where's Amber? Is she okay?
What have you heard?
Pulled from the pool.
So we're doing that for her now, and we're trying to get her heart started again.
So her heart's not started?
I love you so much, Gina. I am so sorry.
She's with our social worker.
I should be with her.
I'll be right back.
Down the hall a bit. Hang on. We got it.
Rhythm check. Hold compressions. Asystole. Resume compression.
All right, come on, Whitaker.
I can't take it much longer. Eileen, how soon can you get here?
A lap chole. Shouldn't be long.
Your daughter's here.
Hi, honey.
Minimal relief with 2 of Dilaudid.
That's what I've been telling them.
We're titrating. We didn't want.
So would there be a reason to need that?
To need the Dilaudid.
That much?
Well,
Lots of blood cultures and 3.375 of Zosyn.
so I kind of maybe missed when she came in. I'm not really sure if this is the sickle cell or some other process. I'm not sure.
Ready for some more Dilaudid?
Tori will make sure all of Dr. Shumsey's orders are followed. Great move bringing in Javadi. Is this patient payback for dropping the scalpel? If she goes to the OR for perf, you can...
Perf. So something perforated.
A weird vibe out here. Pediatric drowning will do that. Glad I didn't end up in there. You and me both. Oh, it's from the Lost and Found, from my patient in Central 8. I'm off to North 2, to Syria. What happened to 2 visitors a patient? Fentanyl overdose. It's gonna be an honor walk. He's an organ donor. We'll see you later. See you. Myrna? Myrna.
Oh, no.
No, not today. Myrna! What are you...
That's kind of how you wake up.
Really?
Hi, I'm Dr. McKay. Laura. And you guys are...
I'm an accountant and she's my assistant.
Burr, are you okay with your boss being here while we talk? I'm gonna be asking you some pretty personal questions.
Mind we have no secrets.
It's kind of weird.
Interesting dynamic.
Why don't we let Piper answer the question?
We've been waiting so long.
About 2 days ago.
Any blood in the urine?
I don't think so.
No, she would have definitely noticed that.
I'm gonna get you a gown and I'll be right back. Okay?
Yeah, they definitely need to talk to her separate.
Any change with the extra Dilaudid?
Not really. The pain is still there.
Sorry.
Oh gosh, she's poking her now.
You tell me everything you did this morning.
Had breakfast, some coffee, jam, yard work.
Did the pain start before or after the firewood?
A little bit after. Glitter in my foot. I wasn't wearing socks.
She got bit.
Tetanus?
Why did I have to deal with my Crohn's disease?
Black widow venom can cause muscle spasms in the belly. Surgery thinking it was appendicitis.
Hi, Dolores. Why didn't you get her to CT yet? The abdomen is rigid. She's perfed.
Maybe not.
Diazepam.
I didn't order that.
I did. No other GI signs or symptoms didn't make any sense. Widow spider and a bite mark on the foot. Spasm of the abdominal wall musculature.
Whatever you guys gave me.
Valium's better for that.
Interesting.
Definitely. I'm much better.
So Valium controls seizures.
look of
and
approval.
Also Black widow venom.
Well, so it's good for like muscle spasms. So they used to give Valium like on the battlefield for, soldier injuries and things because it would calm them, but also help some of the pain.
I don't have a phone.
I'm just getting
She can
like
use mine if
sex
she needs
trafficking vibes from this.
Yeah. She's awfully,
Okay.
she's a bit older than
Lay
most
down.
sex trafficking victims, right?
I don't know that she's definitely under 30.
You gave us a urine specimen?
To go in the waiting room.
Well, I'll find the results and then you might need a pelvic exam.
That really necessary?
If there's no bladder infection, it's important to check. And if we do a pelvic, Laura will have you step outside for a minute.
Prefer to stay with her. First support.
She's not buying that.
Core temp is 88. Is that good?
It's up from 85 on her arrival.
Yeah, that's.
We're headed in the right direction. You hear that, Amber? It's better. You're getting better.
I need to step out for a second. You're in good hands. Come find me when it's over 90.
How long can you keep that going?
I
Is
mean,
it causing brain damage? But no, because she's getting oxygen or.
well, whatever. I mean, however much time that she was without oxygen, yeah.
Okay.
That's what CPR is there to do. It's to help keep blood flowing.
They said it'd be good for 10 years. Yes, but the wire's sprayed from the box. It happens sometimes. You have a visitor?
Of course, right this way.
Hey, Eli, what did your dad do for a living? Postal worker, 40 years. Did he ever do any volunteer work at the hospital? As a kid, he was a medic for the Freedom House ambulance service.
That made him very excited.
Yeah.
I thought they were going to say, no, he just watched episodes of ER.
Yeah. Nah, I think that would have been a little too, cliche.
Yeah.
Maria moved here 2 months ago from rural Pennsylvania. She's with her female boss and answers questions for her. Won't leave her side for anything, even a pelvic exam.
You're thinking...
Called it.
We need to take a sexual history and do a pelvic and private talk unless we separate them.
That we can do.
I mean, sex trafficking comes in all different forms. It could be like her pimp.
Yeah, I mean, I guess
basically.
I guess when you first said it, I was thinking about trafficking of children,
Yeah.
but obviously here you have a power dynamic where you have somebody who's probably very wealthy and then someone who came from rural small town.
Sometimes they start them young get them hooked on drugs.
Yeah.
I've had to do a lot of those classes.
All we had was police paddy wagons that took you to the hospital if you were lucky. You got some money and trained us up.
You must have been a good student.
Hell no. I was a knucklehead. Smoked a lot of weed, dropped out of high school. Freedom House trained me up, saved my life.
Feeling his pacemaker.
You're moving your old pacemaker.
Diagnosis made.
Yeah.
Spinning that thing around caused the wires to break off.
Yeah, he's just fidgeting.
We'll put the new one in a little deeper. Won't happen again.
I don't think you like that.
How long is that going to take?
I can do it right now.
Sorry, there's radiation. You won't be able to stay with her. Be back as soon as the scan's done.
You're good with this.
Pregnant.
Temp is up to 91.
She's so much warmer.
Can you shock the heart now? Warm enough for her heart to respond.
Oh, compressions.
Come on.
Resuming compressions. Got the potassium level back.
12.2.
Is that in the child?
I assume.
Discontinued 1451.
Oh, sweet.
That's it. We're done.
Let me get the gurney up.
Well, I didn't think there could be anything worse than the overdose, but
You need antibiotics twice a day for 10 days, and he'll need treatment too.
If I don't tell him, is there a chance his dick will fall off?
Don't tell him a public health nurse will. For HIV, syphilis, gonorrhea, and hepatitis.
Any other sexual partners in the last few months?
Not really.
not really.
Dr. King and Dr. Collins are here.
I'm coloring.
You're a very good artist. What have you heard about Amber?
She's really sick, but the nurse is trying to make her better.
What's make you sad? You know I have a sister too. I don't like it when she's sick.
She saved me.
She did.
Helped me get out, but then she couldn't get out. I'm making her a card.
Is that how a lot of drownings happen? Obviously, I'm trying to deflect here. Talk about anything else.
I should be out there for the honor walk. Mrs. Phillips, your son would like to speak with you. Dr. King can stay here. Right? Yeah. Be right back.
Although I don't really think that the doctors would be breaking the news to the younger sister.
In their best.
That's not probably.
If you tell Bear everything you want to tell Amber, sit her on Amber's pillow, and then she'll tell her everything you said. What do you think of that plan?
I like it.
Yeah? Do you want to give it a try?
Hi, Amber. It's me. Thank you for saving me. Come home, touch your toys without us. And I try not to fight the whole entire world. I love you.
Where do they find these actors, man?
They're so horrible. They need to be better at it.
How long have you been working here?
32 years.
All in the ER?
Yeah.
Oh, man. How do you do it?
I like taking care of everyone. And the ones who fall through the cracks, they got nowhere else to go.
Well, you deserve a medal.
Settle for a raise.
Now we're going to have an honor walk.
I think this show's evil.
We were just saying how last episode wasn't as gut-wrenching, and they were like, okay, hold my beer. It's
Car and driver waiting so John and Lily can follow right behind the ambulance.
So we won't be seeing you again?
I think a lot of us here would like to attend Nick's funeral.
Yeah, of course.
I think we should be crying this whole episode.
So I have participated in honor walk.
It's not something to brag about.
No, I mean, yeah, I mean, it's not something that, I mean, it's a beautiful thing. Obviously, it's not something you, celebrate or want to have to do it.
But he has Steelers blanket on.
Yeah, well,
That makes it harder to watch, right?
so, really.
I'm just missing. Deflecting.
Yeah, in this case, we allow it.
Oh, they are at Pittsburgh.
Yeah.
Yeah.
The Pit.
Duh.
We talked about this episode 1.
Oh, wow.
God. All right.
Okay.
Well, at least it's over. God. Like in a good
I
way.
mean, yeah, that went by really fast, but that was, I don't want to watch it again. I don't know how anybody could go through and watch a reaction of that. I'd be like crying again.
Yeah. Oh, I mean, that's sometimes what kind of cathartic though.
No, I do not like to cry.
You do not.
No. I mean, maybe nobody really does.
No. So I think easily the toughest episode. I mean, the overdose, brain dead episode was terrible. This is to me so anything that involves kids, I have a hard time with.
That's because we have them.
Obviously, we have children, and children are innocent. So obviously, that was terrible. I wrote down notes. I don't even know if it's
I know, but it was before all that happened.
These are so kind of irrelevant now. After that, so I mean, for our sake and for your sake, I kind of hope they don't revisit that. I think they will, unfortunately, because the poor younger sister, who again, it's like they find this actress who just, I would prefer it if you could tell she was acting.
Right.
Then it would be like, oh, okay, she's clearly acting. Obviously, we know it's a show, it's drama, but these things happen, sadly. Thankfully, I'm not a ER doctor or a pediatrician, so I don't ever witness that. I mean, sadly, I do witness.
You did have it with one that was transferred to a hospital, right?
I don't recall that.
Was there a little girl? It was a car accident.
Oh, this is when I was in medical school.
Yeah.
Yeah, that was.
She was triaged wrong, right? Or by not wrong, but they didn't know she was as bad off as she was.
Yeah, I mean, I vaguely remember this story. I wasn't involved in it at all. It just was maybe a story I'd heard. I wasn't part of it.
Happened while you were there.
Maybe.
I know, it was a long time ago. That one stuck with me.
Yeah. Anyway, so what I wrote down, I guess we'll go through it anyway. Obviously, the drama there with Santos and Langdon, that's going to eventually boil over here with some accusations of abusing, say, benzos or using benzos. Alcohol withdrawal. I don't know if we've touched on this at all throughout this season, but alcohol withdrawal. So obviously that patient who came in with intoxicated, alcohol withdrawal can be very, very dangerous, and it usually sets in around, say, 72 hours after the last drink. Sooner, I suppose, depending on how heavy a drinker somebody is. But
which patient was this?
Oh, it was that gentleman. Was it Louis? Maybe the patient, the guy that came in and said, like, basically happy hour. That's a lethal dose. Lethal dose for us.
I was mixing him up with the pacemaker guy.
Yeah.
Okay.
But so I think his name was Louis. But he's a frequent flyer. They know him. Comes in intoxicated often. So it's actually interesting if you're admitted in the hospital for, say, some other issue, and through the questioning it comes up that you are in fact an alcoholic or have at least a risk for alcohol withdrawal. You do get put on a withdrawal protocol where we try to monitor you. Librium was the medicine here that they were using. That's a common medicine to help treat alcohol withdrawal. But actually, it wasn't uncommon in our hospital to if you would ask the patient if they had any interest on stopping or cutting back, and if they said no, well, then oftentimes we would actually prescribe alcohol with their dinner. So like 2 beers with their dinner of I don't know what we kept. I'm sure it wasn't that expensive. It's probably cheap stuff. But yeah, like, so you could actually serve alcohol because we don't want them to withdraw, right? They're there for cellulitis or whatever. We're treating that. Like, we don't want you to go in withdrawal. We're not if you're not interested in quitting, then we're not even going to try to go through something that's potentially dangerous. And so I wrote that down because that was kind of interesting. I don't know that that's come up yet. I did kind of write down about the pacemaker guy. It was just kind of funny to me how it is. So you see contrasting personalities all the time, right? So you have some folks who come in and literally, like, his pacemaker's not working, his heart rate's dropping to dangerously low levels, and they're like, "You doing okay?" "Yeah, I'm good. I got no problems." Now he's also has dementia, so that part of that plays a role there. I had an old attending that call that pleasantly demented. When they're friendly and happy, they're just not quite all there. So I wrote that down. We full circle on the caregiver fatigue. She made it back. She fell asleep.
She did not abandon her.
No. This is an area of medicine. So in outpatient world, I get frustrated with the lack of resources, the cost of resources, because this is so true. It happens all the time. We have these needs and we can't meet these needs because they are extraordinarily expensive. Insurance is terrible. And so they never want to cover it. You spend all your life paying into these things, and then you have no limited coverage after that. So that's an area of frustration that I see every day.
You're talking specifically with Medicare, like after 65.
Yeah, I'm honestly all insurance.
I know. That's a
commercial, not commercial. I mean, Medicare. It all sucks. Actually, and I wrote this down too, because when Dr. Langdon said that why pick the ER, right? Because we have ADHD and everything else would be boring. I actually wanted to be an ER doctor when I first went into medical school and kind of was coming. Well, obviously not when I was coming out because I had to apply for residency, and I applied for internal med. But yeah, I wanted to be an ER doc because to me, like, when I thought of what a doctor was, like, my image of a doctor was an ER doctor. It was someone who had all of these skills. Like, I wanted if something happened in the field, if something happened.
The field?
Yeah, well.
Like you're out in the, what is it, say the hills of, I can't think of the name. Morgandy, that's not it.
I have no idea what you're talking about.
I'm horrible with history.
The beaches of Normandy?
Yes, that.
Yeah, no, I wasn't going there. No.
That's what it sounds like. Out in the field on the beaches of Normandy.
No.
Okay.
We were not storming any beaches of Normandy. D-Day. No. So, no, like if you're on a plane, right? If you're on the plane, is there a doctor on the plane? Or kind of my epiphany moment where I even wanted to become a doctor. I don't know that I've ever shared that, but it was witnessing a cardiac arrest in the parking lot of Costco, being helpless, right? Because, like, I didn't know what I was doing. So my thought was, be the profession that can always do something about anything, no matter where you are. But as I got into medical school and as I got further into my studies, it didn't resonate as much with me as internal medicine did. So that's ultimately why I decided. And I liked the longitudinal relationship. I think I have mentioned that before. Like, I enjoy being invited in sort of to the family, and we have that decades relationship.
I don't think you've mentioned that.
Did I not mention that?
Well, you have a podcast episode.
Oh,
on
maybe
it.
on the
But the importance of primary care.
Right, the importance of, go check it out. Well, no, because it's like, I make this comment that what I like about being your primary care doctor is it's, you know, so if you go to the ER and you leave and they give you pills for an infection or whatever, and your family calls you and says, hey, what did they say? They'll say, oh, the doctor said I had this, or the doctor said I had this, they gave me this, right? When you go to your primary care doctor, when you're telling that story, it's my doctor.
Mm-hmm.
And so that's sort of that, like, I know it's a little...
I feel like you're part of the family.
Exactly. So that's why I went into that. ER doctors, obviously, you will, I mean, we've seen here, you'll have, quote, frequent flyers. So there are people who you obviously have a relationship with, but ideally you're not seeing them very often, frankly. I always make the joke to my own patients. It's like, you know, next time let's run into each other over at the grocery store, right? It's like
Yeah.
that way, because it's like nobody wants to come into the doctor, generally speaking. And I think the only other thing I wrote down, because we're not going to touch on kids drowning.
Why not?
Not tonight. Was the trafficking case here. So
yeah,
not uncommon to have a patient where the family member likes to sort of take over, answer all the questions. And this is something that nurses and doctors are sort of kind of trained to, I don't know, work through a little bit, right? You want the answers coming from the patient. And so I've had to kind of say the same thing. Maybe not. I've never had, thankfully, this type of situation, but I've had to say, hey, you know, let's hear what they have to say here. Let's hear it in your words. And so that's usually fun. We're able to succeed with that. This is obviously a different case. This is something, you guessed it, some kind of trafficking case. So I guess we'll get to the bottom of it here soon.
I've experienced that before.
So you want to go into that a little bit?
Well, as being a hairdresser, I think it was pre-COVID that they started making it, at least in Ohio. I don't know if this was like across other states, mandatory to have sex trafficking training as part of your license renewal. So it was like after that training, you would like think back of times of, oh, that was probably someone that was being sex trafficked. Possibly. I just remember a particular person that had come in with their boyfriend or husband or friend, a male. That's why I found this interesting, because it's a woman. It was typically a male that they would come in and speak for them. And these girls would speak English. It's not like they didn't speak English. And the men would tell you exactly how to change their hair. Like, and there would always be complete changes.
Like complete transformation.
Yeah.
So yeah, obviously that kind of.
And then you're supposed to, as part of your training, like, you're supposed to like try to get them to separate from them so they can talk to you. But like, I don't know, I'm not like a detective. I don't know. It's hard.
Yeah.
Like, how are you supposed to handle that?
In the medical field, it's a lot easier, right? Like,
yeah.
That's
what I'm saying. She's kind of tricked her.
But honestly, though, truth be told, you wouldn't even have to do that. Like, they could have said, hey, you need to step out. Like, this is obviously you want people to do things willingly. Like, you try not to have that. You don't want to be contentious per se, but like, if you need to, you need to. And if you want them to step out, then you tell them to step out. And that's not negotiable. What you're referring to would be a lot more difficult.
Yeah, because there was nowhere. I mean, they're in your chair. There's nowhere to like say, hey. I mean, when you could say you could wait up front if you want, but they don't. They just sit back there and stare at you the whole time.
I mean, I don't know. I think
they follow you to shampoo their hair.
Yeah, obviously that starts to raise some suspicion.
Mm-hmm.
Well, I don't know. I mean, obviously, so her boss, right, is pregnant. So I think there's going to be an interesting dynamic here.
Yeah.
So maybe she is, quote, grooming her, for somebody else, I suppose. I mean, I think there was that story several years ago that pretty famous. She was an actress. I mean, I think she's a fairly well-known actress who was part of some like group that she would almost lure girls in, and I can't remember the whole story there. That's going back quite a ways now.
Yeah.
But anyway, this show keeps hitting on all the hard topics.
Does it get less hard from here, or do I need tissues next to me? I could have used that.
Yeah.
Answer that for me, please.
Or any more kids involved? Because that's
I know.
like, not to sound mean, but like it's significantly less sad for me if it's not a child. Like a child.
Okay, that sounds bad.
Well, no, it's just, but
yeah, that was horrible.
Anyway.
Gosh, how are they allowed to keep airing these episodes? So.
Well, 8 episodes down. I think there's 15 total for the season. I think. So 7 more to. Gosh, we're barely over halfway. Okay, so well, we will get there.
We are gonna get cranking these out for sure.
All right. Well, I guess that's all I got tonight.
All right.
Till next time. Take care.
Bye.
I am Dr. Todd.